Come on.
Hello, this is Dr. Jack Einhaber, and this is the fourth video out of the 5 videos regarding healthcare. And this one, we're going to look at some personal encounters that I've had, but that have a meaningful lesson in terms of how to improve healthcare. And lessons really for everybody in how to look at their own health situation. So what happened was, through an accident, a tube that I had in my liver was dislodged. I'd been enjoying excellent health, and this tube became dislodged. I was actually doing a public service when it became dislodged accidentally. So the first couple of days I felt very good. And I went to see my doctors, and my surgeon, who had the reputation of being the top biliary tract surgeon, which is part of the liver, said, maybe it's okay that it came out. But then I started to get symptoms that were very troublesome. And my blood test showed a large rise in some of the liver function tests. A large rise meaning in a negative way, not in a positive way. So I went to see 7 different doctors. 5 of them said to me, it's probably okay. They said, your albumin, which is a measure of the strength of the liver, it's a protein that's produced by the liver cells, or hepatocytes. They said, that's pretty high. They looked at me and they said, look how healthy and muscular you look. If you look at some of my medical records, the doctors described me as a strapping, robust male. And 5 of them said to me, everything should be okay, let's not do anything. 2 of the doctors said to me, however, you probably need an exploratory surgery to see what's going on. And eventually my symptoms got worse. Now, again, I'm going to emphasize how important physical condition is in surviving a lot of healthcare crises. Athletes and people in excellent physical condition recover, they rebound much, much quicker than sedentary people, than people who do not have a healthy lifestyle. There are exceptions due to extraordinary genetics, but in general, these have been my observations. Now, so when it came time to have this surgery, the initial surgeon told me, who had said, well, maybe you don't need a surgery or whatnot, or just let it go. He became convinced that I did need the surgery, and he said to me, we might have to cut you open and close you right back up. And it turned out that he was barely able to save me, going backwards through the back of the liver inside. He had to do a special kind of procedure called a Witzel tunnel. And anyway, the lesson from this is that a lot of times the doctors, and these were top doctors that I saw, and they were from all over the place. I mean, I went to see doctors in Toronto, San Francisco, New York, Yale University Hospital, and the doctor over there did give me the right advice, and one of the doctors in New York gave me the right advice. But you have to go a lot of times by what is most, what seems to sit most right with you, because I knew I wasn't feeling right, even though I still looked very strong and healthy. So anyway, so that's one example. The second is, after my liver transplant, I recovered a bit slowly, but then my albumin, again, which is a function of the strength of the liver, went up almost to the highest level of normal. And they had never, the doctors that I had seen and talked to, the liver specialists, hadn't seen these levels before. Normal goes from something like 3.5 units or of albumin per certain milliliter of blood, I think, per certain little unit of blood, and from 3.5 to about 4.9, and I was about 4.7, 4.6, 4.7, very strong. My sex drive was very high, and I was very muscular again, even when I didn't exercise. However, after about maybe a year of enjoying this excellent health, suddenly my albumin dropped from this 4.6, 4.7 to about 3.5, 3.6. I went and I saw a bunch of doctors again. Several of them said, and actually most of them said to me, "Oh, normal is normal." I said, "But it fell. Look at the percentage. Look how high it fell. It fell from 4.6 to 3.5. That's a large drop." But they disregarded that. They said normal is normal. But see, it wasn't normal for me. And a few of the doctors said, no, that's not normal. That's too big a drop. And it turned out that what happened was I had a very serious problem. The liver, luckily, is fed mostly through a vein. The blood comes in mostly through a vein. The portal vein. And the liver has a relatively small artery which feeds it the oxygen-rich blood. And that's called the hepatic artery. And it turned out that my hepatic artery had completely closed off. It had completely scarred up. And had this occurred the first year, they would have retransplanted me. But since it occurred after the first year, they thought that my body was able to adapt. And the test showed that I formed some what are called collateral vessels. So I formed some smaller blood vessels which were able to feed the liver. But still, it's not what it was during my first 15 months after transplant. I had to eventually have tubes put in temporarily. I'm not sure if that was related to this problem, but that resolved itself, and so I was very lucky. But the concept of what's normal does not necessarily apply to everybody. It would be like, let's say, in a gym class, where the teacher might say to everybody, "Okay, get down and give me 20 push-ups." Well, 20 push-ups for somebody who can only do 5 push-ups is an unrealistic demand. And 20 push-ups for somebody who does 100 push-ups at a time doesn't have much of a training effect because they're way above that level. So, this one-size-fits-all approach has to be watched very carefully. Now, I had another incident where right after the transplant, I started to feel, put it this way. The first 4 or 5 days, it looked very bad for me. My kidneys had shut down, and I was going to go on dialysis and all this sort of thing. And then my kidneys came back. It so happened that I required approximately 80 units of blood products to survive the surgery, different transfusions, whole blood, platelets, etc. But on day 6 and 7 after the transplant, I started to feel wonderful. I started to look good. I started to feel great. And it was just tremendous. Then the 8th and 9th days, I started to go downhill rapidly. I couldn't keep my eyes open. I was in bad shape. But my doctors didn't believe me. And they disregarded my feedback. Because they said, look, your liver function tests are normal. I said, but there's something major wrong with me. They said to me, we're going to send you home. You may have to come back, but you're going home. And the home nurse came and saw me. I was just listless. I just could hardly even respond to anything. And it turned out that they made a mistake. That later, I was in severe acute rejection, which means that I almost lost the liver. And they said, oh, well, this is only the second time we've ever seen this happen and whatnot. But what I'm trying to say is that sometimes the judgment of the physicians is not that accurate. They can make mistakes. Now, I would caution people, especially in medicine, a little bit of knowledge can be a dangerous thing. If you only understand part of a medical condition, you might seize on one aspect and disregard other aspects. And I think we talked about that in one of the other videos. So you have to, if you're going to try to converse and contribute with the doctor, you really have to try to learn all aspects and try to understand the illness. And and that's not really possible for some people, because and it's no shame not to be able to do that, because some of us just aren't amply educated, or we're just not oriented toward this kind of understanding or knowledge. But it is good in general to try to learn as much as you can about your illness. Okay, I'm going to give another example. My body temperature tends to run low, especially in the morning, and probably due to a low-functioning thyroid. I'm hypothyroxic. I need thyroid medicine to help regulate my thyroid gland, which in turn regulates metabolism, which is the buildup and breakdown of substances that you take into your body in order to get energy and whatnot. So it has a lot to do with energy level, how efficiently calories are burned, so it can affect body weight and that sort of thing. Anyway, so I told my doctors, and these were top doctors, that my temperature was kind of high in the morning. Instead of being between 96.8 and 97.2, the temperature was 98.4. And they said, that's normal, that's ridiculous, don't worry about that. I said, I'm telling you, I know what my normal temperature is, and I'm not feeling quite right. I said to them, I'm going to have a big fever later today. And they were astonished when I had a very high temperature that evening, close to 104 degrees Fahrenheit. And after that, they took me a lot more seriously. So I was able to learn my body a lot. I had to pay attention because of all the medical challenges I had. And anyway, so that's just another example. Other examples are, I had injuries a lot of times where doctors didn't think I was very much hurt, and they didn't take into consideration that I had a very high pain threshold. I'd been a firefighter and a smoke jumper, parachuting firefighter up in Idaho. I went through some incredible training, incredibly rigorous training to go, within the scope of the smoke jumper training, and some very, very rigorous training, SWAT training, as a police officer. So, and also as a member of an elite riot suppression team. So my pain threshold was a lot higher than normal people's, and also because I was an athlete, and athletes do generally endure different types of pain than other people, and so I would say that probably most athletes have a much higher pain threshold, a much higher more defenses against feeling pain, that sort of thing. So, doctors need to take all of this into account, and a lot of times I find that they don't. Now, after my transplant, I was mismedicated. They gave me the wrong medication. They gave me high levels of thyroxine, medication for my thyroid gland. And in the meantime, what probably happened was that the surgery shocked my body in some way, and my thyroid function had turned around. And so instead of being low functioning, my thyroid started to be much higher functioning after the surgery. And maybe it was because my body recovered and I was now functioning with a very excellent liver. But in any case, they gave me too much medication, and this thyroid medication damaged my bones, and I suffered 3 breaks. But the doctors wouldn't believe me, and they wouldn't believe that I was suffering such high pain. And they basically discharged me from the hospital. And then it turned out I got some other doctors at another hospital to do tests, and they showed these substantial fractures in my vertebra or bones in my back. So another hospital offered to hospitalize me because they knew how painful these injuries were. But I would have had to switch over to their transplant program. And at that time, I wasn't comfortable with that. So I just suffered at home. It was just really horrible. I could hardly move. But again, it shows that sometimes one set of doctors will ignore your symptoms, and another will find out what the root cause is. And I did get some help at the second doctor who was at hospital for special surgery. He found the breaks. He had the lab construct a back brace for me, which I actually wore from the front. So it's it's a delicate balance, but the computerized program would have likely been able to delineate that the kind of pain I was feeling and the pain pattern was due to this kind of a break. Okay, eventually I wound up having 11 or 12 breaks, or 13 breaks actually, when we considered rib fractures and 7 or 8 fractures in my spine, till my body readjusted and my bone density improved. But it was very bad. It was described by one doctor as the equivalent of an elderly woman twice my age. So that's with respect to bone density. Another incident that happened was I was being treated by residents, and the reason I even went in the hospital was because I was having a bunch of symptoms, and a friend of mine, a good friend of mine, a nurse from another hospital that I'd previously been in, looked at me and she said, "Look, your lips are blue." She said, "You're probably anemic." And sure enough, they tested me, and I was quite anemic. And for a few days, the residents were trying to figure out like what to do for me and whatnot. And then one day they come in, like they were fed up with the case, and said, "You have the anemia of chronic disease." And I said, "Well, what does that mean?" "Well, we see this in chronic disease a lot of times. You're anemic because of that, and we're sending you home. There's nothing we can do for you." Well, again, I went to another doctor, and that doctor gave me, I think they're called hemopoietin injections to stimulate the bone marrow to produce more red blood cells to combat the anemia. And my body responded well to this. And I came back almost into normal range. I'm a little below always, but not as far down as I was. My normal hemoglobin levels are in a male something like 13 to 17, and maybe in a female something like 12 to 16, depending on the lab and the population that they use and the standards that they use, but roughly that. And I had gone way down to 6, so I was kind of in bad shape. That was very low, you know, and you know it brought me up to I think 10 or so, 10 or 11, and later you know I got up to 12, and you know and I hover in that range. So again, it's very important to try to find, you know, the right people to deal with your illness, and you know, medical people that are willing to listen, medical people that are willing to go that extra step. I've got to tell you that the finest resident that I had was a young lady of, I think she was born here, but her parents were of African descent. And she, and this was again at one of the top hospitals. This woman was what a doctor should be like. I mean, she spent hours and hours researching her patient's condition. She spent hours, you know, time listening, taking that extra step, accommodating the patient for what they needed. I mean, just a wonderful, wonderful, lovely young lady. So she stands out, and I've got exemplary doctors that I've been privileged and fortunate enough to have come into contact with all the way through. I would mention their names, but I don't know if they want to be deluged, you know, by a lot of extra patients coming to them and whatnot. Okay, now let's see here. Yeah, another example of what happened was after my transplant, I was running fevers, and my doctors did not even give me a chance to even discuss this very much with them. And then it turned out later I developed a heart problem, a valvular heart problem, because I had what is called endocarditis, an inflammation of the heart, and it damaged my valves. And it was unnecessary. A lot of this stuff was unnecessary. Didn't have to happen. Did not have to happen. I had another situation in which the well, my wound didn't heal up correctly after my transplant, and that weakened my spine, and that probably led to some of the fractures that I had in my spine, because the abdominal muscles create what is called traction, so they pull apart the bones of the spine, so they prevent too much pressure from being on the bones and the discs or the cushions between those bones. The studies have shown that a 150-pound man lifting up a 200-pound weight with knees straight, which is not a good way to lift, but it's not that unusual a task, creates so much pressure in the discs that the discs would be expected not to be able to accommodate that kind of compression. However, the discs do. And so in this study, they found out that the reason that the discs are able to withstand that kind of force is because of the traction created by, a lot of it, by the abdominal muscles. So when my muscles were cut in the front during the transplant and didn't heal up right, I consulted with experts who agreed with me, biomechanics experts. That's mechanics applied to living, to people and other living things. That this flaw, for the 4 or 5 months that my abdomen didn't heal up, had a causative effect in terms of causing some of these fractures that I suffered, in addition to the improper medication that I had. Okay, eventually the surgery was corrected. My doctor put his foot down. They wanted to wait another month or two after the 5 months for the surgery, but he pushed hard, and so I had the surgery a month later. So that was good. This particular doctor helped me out a lot of times in a lot of situations, but in a lot of situations he was very detrimental. When I came to him about the pain I was having in my back, he said, well, why don't you try these stretch exercises? And he just gave me these basic exercises which are used to stretch out tight or spasmodic lower back muscles without doing the testing that was needed, that would have shown what the other hospitals and other doctors found. Okay, I told you about the severe acute rejection, which I barely survived. Let me see, what else do we have here? I can tell you that my father probably died when he did unnecessarily. Turned out he had pneumonia, but the doctors did not do an x-ray. They just listened to his breathing, and they didn't hear all the fluid that was inside. And I found out later that a lot of times you can't tell by listening with his stethoscope whether there are rowels or fluid sounds, crackling noises, and that sort of thing in the lungs. And that's what happened to my father. And he eventually died from it after being on life support for a long time, after being revived from a cardiac arrest. Now, my stepfather also suffered a malpractice. And these are people that did not sue. My stepfather had a stroke. But when he went into the emergency room of one of the most reputable hospitals around, the resident said, all right, squeeze my hand, or the emergency room doctor said, squeeze my hand. And he was able to squeeze pretty hard, because he was a very strong man physically. And so the doctor said to him, with grip strength like you have, you couldn't have suffered a stroke. Well, turned out he was wrong. And so they didn't treat him for the stroke. And so the stroke caused some permanent damage. He had trouble with his manual dexterity. He was dropping things and whatnot. So they took one measure and generalized incorrectly from that measure. And so my stepfather was not treated with anticoagulants. Stuff that stops the blood clot, that dissolves the blood clot, which is lodged in the brain and which causes the stroke or cerebro-brain vascular blood vessel accident. Now, there's a lot of talk about how great the Canadian medical system is. Now, most of my family is in Canada,